Good evening, everyone. Welcome back to Black Doctor. I am your host, as usual, Dr. Renee. And tonight we are talking about our skin. In case you guys haven't noticed, there is a really crazy commercial that shows a lot of people and the effects these masks are having on their skin. The people are actually frontline workers who have to wear masks for very extended periods of time. But I know a lot of you want to know what is the effects and all of that great stuff. But we have an awesome dermatologist with us tonight, Dr. Michelle Henry, my new best friend. So Dr. Henry, thank you so much for joining us this evening.
Thank you so much for having me.
So everyone, please make certain that you do your watch parties, as we always do at the very beginning. Please do your watch parties. And if you have questions, you guys know, put them in the comments. And as I see them, I will try to get those answered for you this evening. But please make certain you do your watch parties. And let's get started as soon as I find this thing. Here it is. Oh, come on. Oh, Lord, it takes forever sometimes. Okay. So, Dr. Michelle, can you please tell us? Let me tell you, honestly, when I saw the commercial the first time, I didn't pay attention.
Yeah.
I saw it a second time, and because what I thought that the woman had the same thing that Seal has on his face.
The scar, like lupus scars.
Yes. But it's not funny, but that's what I thought.
Yeah.
And I realized, oh my God, that's from wearing a mask all day.
Yeah.
And probably wearing 2 and 3 masks at the exact same time.
Yeah.
So what is that called, and what can we do to get rid of it?
Yeah. So, it's tough. So I'm in New York City, in Manhattan, kind of the epicenter of a lot of
Exactly.
Yeah. So I'm seeing lots of patients coming in with all sorts of side effects from prolonged mask use. So kind of the earlier things that you'll see is just a little bit of irritation. So when you have on your mask, what you're seeing that pressure, that friction from the mask. You're seeing the humidity inside of the mask. So that's from the vapors when you talk, the moisture, saliva, and it causes irritation. It can cause dermatitis or a rash. You can have contact allergy meaning you become a little bit allergic to the mask, the fabrics, the dyes. You can get maskne, which is like acne from the mask. That's becoming really common. And the worst, what you're describing, is actually a little bit of skin breakdown. So what happens with friction and moisture and pressure, the skin literally starts to break down. You get bruises. You can get little ulcers on the skin. And I'm seeing a lot of that in healthcare workers and essential workers that are wearing masks all day long for hours and hours a day.
Oh, those poor people. So there is a term for it now. And, I actually did read that somewhere and was like, mask me, what? Then I go, oh, that's the people in their mask, the poor thing. So this will go away though, right? Because I think that's a concern of a lot of people is like, I'm going to be forced to wear this mask and then I'm going to be scarred for life. And,
Yeah, so it will go away eventually, but like you said, we're going to be wearing masks for a really long time. So what I recommend is taking care of your skin to prevent it. That's the first thing you can do. And so the way you do that is by gentle skincare, gentle soaps, put away all of the harsh cleansers that you're using, stop exfoliating aggressively, good moisturizers so you make a good barrier between your skin and the mask. Just really making sure you protect your skin because without that, you're going to be more prone to having breakdown. So it's all about gentle care. Try not to wear as much makeup, makeup, oils, all those things we put on our skin. When we're wearing that mask, we're just really grinding it into our skin and causing things like maskne. So just really gentle, low maintenance during this COVID season.
And you know what, ladies, I'm just going to be honest with you. I've seen a lot of people doing it. And before this all happened, I'm a lash extension wearer. Mm-hmm. Obviously, I've been sheltering in place and I can't see my lash lady. But go and get you some magnetic lashes. And actually, there's a mocha doc, Dr. Anika, that makes opulence lashes. And I will give you a link if someone's interested. But she makes magnetic lashes. She's an ophthalmologist, so who not to trust, right?
Exactly.
Wear lashes, because honestly, if you're going to wear a mask, why do you need to worry about foundation, blush, lipstick? As long as you have, my favorite thing, to moisturize your lips, because obviously they still need to be moist, and put moisturizer on your skin, because of course we don't want wrinkles all of a sudden. Mm-hmm. But make sure you just dress up your eyes, you guys, because honestly, that's all we can see.
2020 is the year of the eyes. That's what I tell my patients. I'm like, don't waste your money on that other stuff this year.
Yeah, just dress up the eyes. That's what we can see. That's what we should do, So put on some lashes and go on about your business.
Mm-hmm.
You know, I think that's the best thing we can do. Now,
Absolutely.
of course, even though I really do, I personally say that Black people, Black don't crack. I firmly do believe it. Black
Mm-hmm.
don't crack. But some people have, wrote into Black Doctor and they're concerned about aging skin.
Yeah.
So what can you do?
So there's a lot we can do. So we all hear that Black don't crack, and now there's Asian don't raisin. But
I've
these
heard that one too.
but it's not necessarily true. We do age, we just age differently. So when I think about my white patients, I call them wrinklers and sinkers. So their skin wrinkles, we see those deep wrinkles on the surface of the skin. They get less bone mass, they get jowly faster than those of us with skin of color or darker skin will get. But what we do is that we are sinkers and saggers. So we lose volume, and we lose volume kind of in the middle of the face. We tend to be a little bit flatter here. And so because we're losing volume, I'll tell you one of the top things that women of color come into my office complaining about, the eyes. And it's because we lose volume here, so we start to get saggy. Those fat pads start to stick out a little bit. So that's an area where we do age. And also, we don't wrinkle because melanin is amazing and protects our skin from wrinkling in that way. But what we do get is hyperpigmentation. So hyperpigmentation is a way that we age. So as we get older, our skin gets mottled, it gets uneven. So all the things that we can do to prevent aging or to slow down the aging process for us, a lot of it revolves around hyperpigmentation. So making sure you're using creams, you're using sunscreen. Yes, we need to wear sunscreen.
We were going to talk about that too. So we'll cover that too.
We'll come back. I'll come back to that. But yes, you need to wear sunscreen. No matter how deep and dark and beautiful your skin is, you need sunscreen. You need ingredients in your creams that help to turn over your skin and stimulate collagen. So things like retinol is really good. Retinol is really just a type of vitamin A. So it's helping your skin turn over. It's helping to reveal those healthy young sin cells. It's stimulating collagen, and it's evening out your skin pigment. So that helps. So sunscreen, glycolic acid, retinol is critical. And then, in my office, when you start to get that sagging, we have lots of treatments we can do. I don't know if we're going there yet. We have lots of treatments we can do in the office. We do some fillers, we do some Botox. I know everyone's gasping, but we do it. I do it in women of color, but I do it in women of color oftentimes a decade later than I do it in white women, because there are a lot of benefits.
Well, there are famous women that have openly discussed it.
Yeah, exactly.
Wendy Williams, says she gets Restylane in her face, which is filler. Right. Vanessa Williams.
Exactly.
As in Vanessa Williams, the mother of 4 children, Vanessa Williams.
Yes, that'll do it.
Yeah, she said she gets some filler in her face. So, some people have publicly discussed, Black people have said, this is what I do. Of course, I think even without the filler, both Wendy and Vanessa have beautiful skin, and probably, but just like you said, they're just kind of ahead of the game, and they're not, they weren't there at 20 and 30. Because I have friends that went to school with me that are not, of the melanin, and they look so old, and I feel so bad because I know we are the same age.
Yeah.
But if we were sat next to each other, nobody would think that we were the same age.
Yeah.
Because even when I've said it on here before that I'll be 44 this year, everyone's like,
yes, you look amazing.
Thank you.
Incredible.
Thank you to my mother and my grandmothers and exactly. But yeah, so I know that this is, it's not by chance. I know that it's genetics. I know it's the melanin and all that. And then I think also, and we're going to talk about this sunscreen thing, I think it's also the fact that we don't tend to do the things that they do when it comes to sun.
Yes, we naturally have more sun safe practices. We don't have a culture of laying out in the sun. A lot of what we do is sun safe. We wear the hats, we hide from the sun, frankly, to me, it just doesn't feel good. The feeling of burning. But because of that, we tend to protect our skin more as well.
Yes. So let's just jump into the sunscreen thing. So I have heard from way too many Black people, oh, you don't need to wear sunscreen, but I am always quick to remind them. Bob Marley died from skin cancer, you guys.
Yeah.
Bob Marley died from skin cancer. And you know what? This also brings up Dre's point. What about blemish spots that you've had for over 10 years? I can't get rid of them. Let me tell you, my little secret tray is back. As soon as the sun comes out, because I live in Chicago, so it's not often that we have sun hot enough. But I try to get as much sun as I can, because it literally, all the dark spots that are currently on my face will just disappear because of the sun, and then it's gone. But what is the proper way to get rid of these?
Exactly.
Right. What's the proper way?
So I'll talk about the blemishes, and then you asked me one thing before that, sunscreen.
We'll talk about the sunscreen. Yeah, go ahead.
So one of the things you can do to so once you have a dark spot, those skin cells are just waiting to come out. So what, yes, if you allow all of your skin to become darker by exposing it to sun, it might temporarily hide them. What we actually want you to do is to wear sunscreen, so give them some time to go away. And then think about ingredients in your skincare. So there are some great ingredients to help lighten your skin naturally: azelaic acid, glycolic acid, retinol, licorice extract, kojic acid. There's so many good over-the-counter and sort of natural ingredients that you can use to lighten your skin or lighten those spots. And then if that's not working in the office, we can do hydroquinone, which a lot of people have heard of hydroquinone. Sometimes it gets a bad reputation, but if you use it for a short period of time, it is safe. If you don't want to do that, then we have chemical peels, and the chemical peels are not like the peels that you saw in Sex and the City. They are safe. They don't make your skin look crazy. You're not red. You're not crying. I do it maybe 3 times a year myself, and then we also have lasers. So I always recommend starting out with some creams with those ingredients that I discussed, making sure you use your sunscreen so it doesn't get worse, and then we kind of graduate if you need.
So now, I had some blemishes, and I told the doctor because they were driving me crazy. So she did prescribe me hydroquinone, and we mixed it with something else. I forgot the other thing. And what she said was, Renee, if you don't wear sunscreen every day, and I don't care if you see the sun or not, the sun is out. Put the sunscreen on, or else the marks will come back. All she had to tell me. I said, okay. And you know what? My moisturizer, I use, I'm not going to name labels because we're not getting paid by them, but I use sunscreen. That's what I use as moisturizer every day, is sunscreen, and go about my business.
And this is why you look so young. This is why.
Maybe. So please talk to us about why we do need to wear sunscreen just like they do. Maybe we don't need SPF, 100, but we need something.
So yeah, absolutely. While melanin is beautiful and it's powerful, it is not perfect sun protection. So even the deepest, richest, most gorgeous dark skin is only SPF 13. And so what we really want for proper protection is SPF 30 and above. And so I really recommend SPF 30 for everyone, no matter how deep, dark, beautiful your skin. It is important to use sun protection for 2 reasons. One, we want to prevent against skin cancer. And I even have family members in my that have dark skin, my skin color, that have had skin cancer. So we see it in dark brown skin. It does happen. And actually, in darker skin types, when we have skin cancer, the outcomes are worse. And they're worse because no one's looking for it. We believe we don't get it. You don't go in. So by the time you show up, it's far progressed. Exactly. So we have to be vigilant. We have to make sure that we're looking out for skin cancer on our own skin. And then also we talked about aging. So protecting ourselves from the sun is also going to reduce accelerated aging and hyperpigmentation. So if I can't convince you to do it for your health, I'll convince you to do it for your vanity. But either way, we need to be wearing our sunscreen.
So, so we have a question. The hydro stuff, you apply it by the spot, right?
Yes, you want to spot.
Not on the whole face, just where it's at.
Not on the whole face. Now, if you're someone who has something called melasma, so melasma is when you get these big dark patches, a lot of women get it after pregnancy, then you might want to do it on a broader area. But for your average person who's just treating spots, we only want you to spot treat.
Yes. So one, and then what I don't know the name of it. Shoot, I should have had it. But there is a Black woman that has come out with sunscreen. Do you know the name of it?
Yes, it is Black Girl Sunscreen, and it is.
Thank you. So you guys, let's support her. Yes. Black Girl Sunscreen. Let's support her and go get that sunscreen. So I shared with you, Michelle, I am West Indian, and so I play mass. And so when you play mass, it was hot as blazes in Trinidad and in Antigua. And I'm like, but my family, the crew that I travel with, we all were like, we all had sunscreen. We all sprayed each other down before we went to hit the road. Because, you're out there for all day. We did like 14 miles one day. So we all sprayed each other down. Now, unfortunately, some of us still got burned. And I'm talking about people my complexion still got burned, and they knew they were burned because they were in pain. And so I went and got some aloe vera gel. And that seemed to relieve it. But the crazy thing is, I did fine in Antigua, came back. I was in Jersey. And when I tell you I was on fire,
oh my God,
I was dying. I was like, oh my God, what is this delayed reaction? And my sister, she literally had bumps, like little bumps from the burn.
That happens.
It
Absolutely.
looked like, as a matter of fact, she took a picture and it looked like a loaf of bread. If she hadn't told us it was her shoulder, that's what it looked like. So you
Wow.
guys have to be very careful because, like I said, we wore sunscreen, but it's just the sun is so, especially when you get in the islands, the sun is serious.
Yeah.
It is not playing. It is very serious. And so you need to protect yourself. So you guys, like she said, if not for your health and skin cancer, let's just do it because we don't want to age like that. We want to look like we're teenagers for the rest of our lives. So another condition that a lot of people have been concerning themselves with, particularly now, because we are so stressed between the pandemic of COVID and then the pandemic of racial injustice, people are having hair loss issues.
Yeah. And I'm seeing a lot of hair loss. And so we are getting stress hair loss. And there are 3 different reasons why we get stress hair loss. So one is called telogen effluvium. And so what happens with that is there's some traumatic stressor to your body. And it could be physical, like a surgery or childbirth, or it could be a psychological stress. So it could be, just the stress, like you said, of quarantine and of having to like protest and seeing all the things that we're having to experience. And that kind of shock on your body throws a lot of your hairs into the resting phase. And then a few months later, they shed. And we call that telogen effluvium. There's another type of hair loss called alopecia areata. And that's because your immune system has been turned on and your immune system is literally attacking your hairs. And that looks different because you're going to get little localized areas of hair loss. Whereas with telogen effluvium, you're just losing the hair throughout. And then there's one more type that we often overlook. It's called trichotillomania. And that is kind of anxiety-induced picking. So it's this urge, exactly. You can't keep your fingers away from your hair. And the belief is that you're getting some sort of release of your stress from pulling the hair. But I've had patients pull out huge palm-sized areas of their hair because of trichotillomania. So stress really affects our hair a lot. And so we see the effects of stress in all sorts of ways, and our hair is not immune to that.
So how can we fix this? I will tell you quickly, I did have alopecia, and they, we tested the dermatologist. She did testing and, make sure it wasn't lupus and all these other things. But we figured out, once I did some reading, it sounded like it was stress induced because my grandmothers died 60 days apart exactly.
Oh my gosh.
And I didn't think I was stressed, but clearly my hair, I had literally silver dollar-sized bald spots in the front of my head.
Oh my gosh.
Yeah, it was bad. And when I say bald, it looked like my palm. My sister was like, "Does it hurt?" Because it looked raw, And so she's like, "It looks like it hurts." I said, "It doesn't hurt." And so I wore a headband for a long time because I needed to cover the front of my hair. But so and it obviously grew back and we're good, but that was traumatic, that was something. So how can people, work on bringing this hair back? Because hopefully, if you don't have, there's certain types of alopecia, obviously, that they might not get their hair back, but the other conditions, you can grow it back.
Yeah, so for all 3 of those that I discussed, you can get it back. So with telogen effluvium, usually it just comes back on its own. So we just try to support you through it. We try to work on not forgetting the psychological part. So try to reduce some of your stressors. I always check nutrition to make sure there's nothing else playing a role. So making sure you're eating appropriately, lots of lean protein, lots of vegetables. And so we kind of watch you, and usually your body will take care of it. Sometimes I'll give you some topical treatments like Rogaine to speed up the process, but typically that will resolve on its own if we can remove the stressor. Now, alopecia areata often needs some real treatment. So oftentimes I will do either topical steroids or injectable steroids because we want to shut that immune system down so it can stop attacking those follicles and distracting the hair from growing. And then with trichotillomania, it's tough. I oftentimes have to work with my psychiatry or my therapist or my psychologist to really make sure that we are also addressing kind of the psychological part of this.
That's wonderful because like I said, mine was, she diagnosed as alopecia, and then I realized that it could be caused by stress. And so, I was, like I said, very grateful when my hair grew back because that was just, especially because it was in the front.
Yeah.
Well, if it was in the back, it probably wouldn't have, but because it was in the front, it was like, hi, here I am.
That's traumatic.
It was rough. Because like I said, I had to literally wear headbands every day. I had a friend who was making clips for headbands. So then I started getting different clips so that at least I had a little bit of change because I couldn't believe I had to wear this accessory every day to cover these spots. So thankfully, like I said, it grew back. But yeah, so definitely you guys, please let's I tell everyone, I've said it the whole time we've been in quarantine. Limit how much time you watch the news.
Mm-hmm.
Don't watch all of it. Don't leave CNN on as your background noise. That's not a good idea. We need to relax, watch. There's so many good movies that they've been putting up on Netflix and stuff. Watch a movie. There's great shows. Watch shows. But you guys don't watch this news all day because today the occupant said if it wasn't for him, we wouldn't know about Juneteenth. You know what the occupant is, right? Okay. So I'm like I said, we don't need to watch it every day. We don't need to watch every press conference.
Mm-hmm.
So, and the protests are Black Lives Matter, and protesting is great. Maybe you protest and then you don't watch the news all day or something. Like you guys can't have both. You gotta choose, because stress is not just your hair, but there's also acne can come from stress. Exactly. All of a sudden your face is breaking out. That's me in quarantine for whatever reason. I don't have acne any other time, but I literally was like, I won't recognize myself if we don't get out soon. But definitely, you guys, please, let's try and minimize the stress. As I've told you many times, stress is also going to compromise your immune system, which would make you more apt to get COVID if you were exposed. So please, let's scale back on the stress. This is a good question. For alopecia, would you suggest hair transplant?
Potentially. So alopecia is a kind of a descriptive term. Alopecia just means hair loss, but there are many different types of alopecia. So if you had something like female pattern alopecia or female pattern hair loss, then you could be an excellent candidate for hair transplant. If you have traction alopecia, so that's the alopecia we see when we always talk about losing your edges because you've been doing braids or weaves or just styling your hair aggressively, that's a fantastic candidate for a hair transplant. Other types of hair loss, there's something called CCCA, which is centrifugal cicatricial alopecia. It's a scarring type of hair loss that we often see more in women of color, exactly right in the center of the scalp. Not as good of a candidate. Sometimes if there's limited involvement, but it can be quite wide, so not as good of a candidate. So it's really important that you have someone diagnose the type of alopecia that you have. And for many of the types of alopecia, hair transplant is a fantastic option.
Yeah, and there, somebody also mentioned something else. Medication can cause you to have hair loss too, and exactly. That is very true. You have to see. There's a lot of medicines that's a side effect. Mm-hmm. You need to weigh your options, see if maybe there is an alternative medication, or it might be a life-saving medicine that you need to take. So please, don't risk your health for your hair, because we can all, Black people, we can go buy some hair. Come on, guys. I should know. So another skin condition, plaque psoriasis. Mm-hmm. So I have several friends actually that have this condition. Yeah. Could you want to see what it is, and then some possible treatments that maybe aren't necessarily drugs, but then also what drugs help too?
Yeah, so psoriasis, it's kind of a chronic inflammatory condition. We inherit the tendency to have psoriasis, and what you'll see with psoriasis are big, thick plaques or scale on the elbows. You can see it on the knees. You can see it a lot on the lower back, on the scalp. We see it a little bit less frequently in folks of color, so in darker skin types, but we do indeed see it. It becomes an issue because a lot of people don't expect it in people of color or in any type of darker skin type. And so oftentimes it's not diagnosed, and patients will have tests and they'll have blood draws and they're trying all sorts of medications on them because it's hard to make the diagnosis because they don't often think of psoriasis, especially in African-American skin. But psoriasis, it sometimes can be a little bit itchy. And the way we treat it is usually we use kind of topical steroids to reduce the inflammation. Sometimes we'll use one of the older school treatments is actually coal tar. So some will use coal tar. That's a real old school treatment, but it's anti-inflammatory and it does help. There are certain things you can do to keep your psoriasis from flaring. So excellent skincare. So making sure that you are moisturized, that your environment is not too dry. So having a humidifier, using good emollients. I absolutely love creams that have like ceramides and hyaluronic acid. I don't know if we're saying brands, so I won't say any brands, but lots of good drugstore moisturizers are fantastic to keep your skin safe. But psoriasis, although it's not as common in Black skin, we can have it. We need to think of it because it's important to diagnose it, not only to to heal the skin, the rashes, but you can also get an arthritis. That could be really crippling. So we want to know that it's psoriasis because we want to look out for all the other features of psoriasis that could really impact your life.
Okay. So yeah, so definitely, yeah, so Black people can get psoriasis. I skipped one question that I know that needs an answer. Does sulfur promote hair growth?
Sulfur may not promote hair growth, but it may soothe the scalp and reduce inflammation that might be impeding hair growth. So you can see things like, we call it seborrheic dermatitis, which is just really aggressive dandruff. And so if you've had really bad dandruff and it almost feels like you get little mounds of dandruff, like you can pick them off, that's usually something called seborrheic dermatitis. And sulfur can help with that. So it can help to soothe the scalp, and inflammation keeps the hair from growing. So it's not that the sulfur stimulates hair growth, but it can get rid of some of the things that keep your hair from growing.
Okay. And you can get sulfur shampoos at the drugstore, right?
Absolutely. You can get it over the counter. There's so many of them. You can get it on Amazon, so you can still get lots of sulfur products.
Awesome. And then this is one of my favorites. I grew up with eczema. I have asthma, and a lot of asthmatics have eczema. And so eczema, you know, I think that I don't hear about it as much, but I do know that if it's not treated, it can turn into really bad ulcers and stuff. So definitely, can you please help us to understand eczema and what we can do to prevent it from coming in the first place, and then once it comes, how to treat it?
Yeah. So eczema is very, very different regarding Black skin when we to psoriasis. So we actually see eczema more in African Americans. So about 20% of African American children, close to 20%, will have eczema. Why is that the case? Well, there are some genetic factors, but we also know that we see things like eczema and asthma and allergies more in urban areas. So that may also play a role. So we see lots of eczema and skin of color. So it's something I see a lot in my office. So you inherit this tendency towards eczema. Often it shows up when you're a kid, usually younger than the age of 5. You kind of see it throughout the course of your life, but you can also get eczema later in life as well. Very, very itchy. In babies, we see it on the face. When we're kind of adolescents, we can see it kind of in the folds of our arms and behind our knees. And then as we become adults, we see it kind of more on the hands. So there's kind of this little march throughout the body as we get older. Lots of things we can do. At home, the first step, again, I'm going to sound like a broken record, but excellent skincare, those same creams to keep your skin moisturized, making sure you have a humidifier at home. If you're flaring, one thing you can do that sometimes sounds a little crazy to some people, but making a little bleach bath. So putting a 1/4 cup of bleach in a full tub of water. For a long time, we believed that what it did was reduce the bacteria in your skin, so you're less likely to flare, because bacteria can flare your eczema. But actually, we think now that it may just be a little bit anti-inflammatory. Now, if you're at home, you're doing all the things, you're using your creams, you're using your aloe, which aloe is really hydrating as well. You're using your glycerin. You're not using harsh soaps and you're still flaring. Then we'd want to see you in the office, because in kids, if we don't treat eczema and it's all over their body, it can be so bad that they fail to thrive. So they're not growing as well. So it can be really serious if you're not able to control it at home. So then we want to see you in the office. And then we talk about some medications, always starting out with the least aggressive and increasing as we need. But it can be severe enough where you need to be seen in the office.
Somebody said, this is a good question. I've not thought of this. Can you talk about caring for dry, peeling face and diabetics?
Yeah, so that's the subject we don't talk about a lot, but diabetes can also affect the skin, and so the skin can become very, very dry. So it's really important to use ingredients that are going to help to moisturize the skin, to help to shed any dry, thick skin on the face, but especially on the feet and the hands. So we always talk about the feet and diabetics because that's an area that can be really dangerous. If the skin is dry, if you get cracks, they're going to be more prone to infections, and those infections can be a really, really big deal. So diabetic skincare is really critical. Again, I'm a broken record, all those same ingredients. So the ceramides and nice rich creams. What I like to do is I actually like to mix a cream with something like a Vaseline or an Aquaphor, mix them together just 1-to-1 and put it on your hands and feet, kind of like a treatment. On the face, you want to use creams, not lotions. So creams are going to be richer. They're going to be more moisturizing. A lotion has more water. So if you feel like you're peeling, you want to look for creams. That's a good ingredient. Urea helps to moisturize and exfoliate a little bit. So for diabetics, that can also be another really good ingredient to have, but low concentrations of urea. High concentrations cause irritation, but low, like less than 10%, is safe to use. But yeah, with diabetics, you have to really pack on the moisture to keep your skin safe.
And so this is an interesting question. What about boils in the inner thighs?
Yeah, so boils on the inner thighs, and that's a really common thing. And there are many different reasons why you can get boils on the inner thighs. So you can get boils and folliculitis just from friction. So just from friction. But there's another condition called hidradenitis suppurativa, which we see more in women of color. And it's this kind of inflammatory condition where you're getting cysts in the groin, between the legs, underneath the breast, underneath the arms. And it can often flare with your periods. Sometimes I have women come in and, we're very secretive about these things, especially if we're seeing cysts in the groin. And I have them ask their mom or ask their sisters, and they also have it. It's been a family secret forever because it's strongly genetic. So if you're having these cysts, you notice they're coming, they're opening up, they're oozing, see your dermatologist, because we can do topical treatments, we can do injectable treatments, we can do oral treatments to help take care of it. Some things you could do at home, make sure you clean the area really well. So use an antibiotic soap, something like a Dial or a Hibiclens, because there's some thought that sometimes bacteria can trigger that inflammation as well. But so there are many, many reasons why you can get these cysts. So it could be just benign from rubbing, or it could be this condition.
What skincare regimen do you recommend for our teens, especially if they are acne prone?
Yeah, so teenage acne is tough. It's usually really, really oily. And with teenagers, it's kind of hard to get them to do anything. So I try to kind of keep it simple. When you're thinking about teenage acne, you really want to think about ingredients. So ingredients that I like are benzoyl peroxide and salicylic acid. Those are going to be my two mainstay ingredients. You want to think about exfoliation. So what is acne? So you get a clogged pore, and either you end up with a blackhead or a whitehead. If that remains clogged and it gets inflamed, then you end up with a cyst. You can have a more superficial pimple, or you can have a deep, painful cyst. So it's all about exfoliation, killing the bacteria that causes acne, which benzoyl peroxide does that, unclogging the pores, which salicylic acid does that, and making sure that the skin is also moisturized enough that those ingredients aren't also destroying it. So a really good cleanser with one of those ingredients, benzoyl peroxide or salicylic acid. After cleansing your skin, you can do a good topical. So sometimes I'll spot treat with salicylic acid. And these are all ingredients you can get at the drugstore. So you don't have to spend a ton of money on them. It's not necessary. You can get them over the counter. And even nowadays, you can get a retinoid, which used to be a prescription. I will say one brand name because it's the only retinoid that's over the counter. It's called Differin. But you can get that over the counter. Once upon a time, you had to come into the dermatologist's office to get that. But Differin is a retinoid, and it's a really powerful medication for acne. So you can get that over the counter. And then making sure you're moisturizing and using your sunscreen, because especially in black skin, acne will cause hyperpigmentation. So we want to make sure that we're kind of preempting that by using our sunscreen even while we're treating our acne.
That is very important, because children can be very cruel, and you don't want to end up with all these acne scars, and
exactly.
So that's definitely something. And they need to watch what they intake as well.
Mm-hmm.
Drink lots of water. That will help your skin. My makeup lady could not understand why my skin looked like this, because I will tell you, I was horrible about washing my face. So, and I knew, and I told her, and she was like, well, then why is your skin? But I drink a gallon of water a day.
Yeah, you're right. Water and diet. Yeah.
So you drink, so make sure you watch what you're eating, because these kids could be eating all sorts of greasy stuff, and that stuff is not good for a whole lot of things in your body, but it's going to come out in your face too.
Yeah, for sure.
Can you shrink pores naturally at home, or is there a treatment a dermatologist can do?
So yes, of course, there are some things that you can use at home. So using one of the best things you could do at home is using a retinol. So a retinol is a vitamin A derivative that helps your skin turn over. And as it's helping your skin turn over, it's kind of stimulating some collagen. And the way I think about stimulating collagen is, if this is your pore and we stimulate collagen around it, we kind of close it, kind of like a drawstring purse. So retinol is good. Glycolic acid is good for reducing the appearance of pores. And of course, if you want to graduate, in the office, we do lots of lasers and chemical peels that will help speed up that process. So yeah, there are some things we could do to reduce the appearance of pores, and it just depends on how aggressive you want to be.
Awesome. Well, Dr. Michelle, thank you so much. This has been very informative. Hopefully, you guys, she will come in the comments if she sees any questions I didn't get, and she'll fill those answers in. But please tell everyone where they can find you, your practice, and you online.
Yes. So I practice in Manhattan, New York. but I also see patients virtually. You can find me on Instagram at Dr. Michelle Henry. So that's at Dr. Michelle Henry, all one word together. I post a lot of videos there. I answer questions there. And you can also go to my website, which is www.drmichellehenry.com. So I'm super responsive. Reach out to me if you need. So I hope to see you guys there.
Awesome. Thank you so much. And I'll make sure that your link is in the post so that people can find it right away. Thank you so much. This has been very informative, even for me. So everyone have a great night, and I will see you next time. Bye.
Bye.